Good morning, trailblazers. So cool to be with you again at 6 a.m. in Pennsylvania. I have music on, but when I see you joining, I'm going to switch it off because it's a little bit distracting. And I see you here. Welcome. Thank you so much for joining me. While you are still joining, I have a few updates because there are conferences coming up. Let me switch on the chat and say hi in the chat. And please say hi back and obviously tell me where you're tuning in from and what time it is in your wherever you are. I was recently talking to a future podcast guest. Maybe I'll later tell you who that is, but basically she said that, she's not waking up at 6. She doesn't have little kids. She doesn't have to do that, but she always listens during her lunch break when the recording comes out. So if you are listening to the recording, let me know as well. And I'll look into the comments later and I'll just say hi and say everything. Just respond to your comments, right? So there's going to be a couple of announcements, couple of things that I'm doing today. So let's start. I have the links, the QR codes for you on the screen. If you don't have the Digital Pathology one-on-one book, which is this book, to start everything all you need to know to start and continue your digital pathology journey. That's the QR code below, and later we're gonna see what's new in the digital pathology store. So I'm gonna take away the store. Richard, welcome. So great to have you. You're in Great Britain, right? Let me know what time it is. Okay. Quick updates and let's do the papers, and then there's going to be more updates. So we start with the next conferences. The first conference is ACVP. That's for my trailblazers from the veterinary pathology side. ACVP is the annual meeting of American College of Veterinary Pathologists. This is where I'm certified. So I'm going to be speaking there about, and the title of my presentation is A Black Box Tool, How to Ensure a Reliable and Liable AI Application. And there's going to be a presentation on that. But at ACVP, I cannot record these things. So what I'm going to do, I'm going to actually practice it. And here, let me tell you how fantastic you are for me, because if it wasn't for you, I probably would just go and speak to my slides and would deliver suboptimal experience to my audience. But because I want to record it for you, I'm going to practice record it, and then I kill two birds with one stone. So black box tool, how to ensure a reliable and liable AI application at ACVP in New Orleans. I'm flying on Sunday. So if you're there, just say hi. And I'm going to just be going in and out for the presentation, so it's not going to be so long. Then another update, SITC. SITC is the Society of Immune Therapy in Cancer. And this is in National Harbor, Maryland, Friday, Saturday, the 7th and 8th of November. And there I'm going to be with Hamamatsu, which is a digital pathology place sponsor. And they have this immunofluorescence imaging device, Moxiplex. Moxiplex makes amazing multiplex images, right? Immunofluorescence images. They're going to be showcasing their partnership with BioCare. BioCare specializes in staining, immunohistochemistry staining, basically tissue staining, and they are helping companies be digitally ready with all the pre-analytics, right? And we have Scott. You guys are regular. Scott, welcome. Atlanta, 6 a.m. He's my 6 a.m. companion. Thank you so much for joining. And okay, so Hamamatsu, booth 451. Let's see if I can write it on the screen. Let me do this. And here I'm supposed to be able to write 451. If you are at SITC. Sorry, 451, stop. Because maybe it's 450. Let me check. What happened to my note? Yeah, 4:15, girl. 4:15. I mean, Dr. Zhurab, 4:15. 4:15. 4:15. Not 4:15. Okay, so SITSI 4:15 with Hamamatsu, if you want to. And I'm preparing something super cool for you, which is stickers. I know it sounds a little bit like, what? Are you a teenager? But I love to put them on my, like, these hydration jars. And I have this, I can show you. See, I should have taken them. Later I show you. I have these Trailblazer stickers. So we're going to make Hamamatsu specific Trailblazer stickers. So if you're a Trailblazer interested in IF, immune oncology, and you're going to be at SITSI, then we can see each other there, because I'm going to be there, I think both days, booth 4:15. And let's start with our papers, and then there's going to be a few more updates. Okay, ACP. Later, I'm going to tell you about how to make a presentation with AI and what I'm preparing for you about that. So stay tuned. Stay right here. And now let's do the paper situation. Okay. I need to be careful with this eraser, because then it erases my other markups. Sorry for that. We're just gonna erase. And we're gonna start with a public in Nephron about I see more people than the people that are commenting, so give me some comments. Show me some love in the comments. So, prospects for artificial intelligence-based pathological diagnosis of renal transplant biopsy. So, what are we talking here about? That AI can help with renal biopsies, basically. And the background is AI initiated in the 50s. Well, we didn't do digital pathology there that much, at least. Maybe we're taking, no. That it had matured after two setbacks into deep neural networks and large language models. So yesterday I was talking to Andrew Janowick, that's another podcast that is gonna drop, I don't know when, within a month, but he has this paper, super cool. I'm going to tell you what they did with this paper. But he says that basically, like, the level of AI and large language models and all that is like discovering fire in the computational pathology space. So yeah, we had these large language models, and it was like discovering fire. So now digital pathology can employ the deep neural networks and large language model, and this is advancing globally. And they say, Japan lags behind. And here a comment. I was actually surprised when I talked to a doctor from Japan at US CAP last year, Dr. Robert Osamura. And he says that they have to do both. Like, if they want to do digital, they have to do digital and glass. So those people who are doing digital there are very motivated, because they have to look at the same thing twice with different modalities. So they say here that unfortunately Japan is lagging behind when it comes to digital pathology. And they want to standardize diagnostic interpretation and reduce the workload of pathologists, and putting it into renal transplant pathology, RTP. So they say that Chameleon 16 and 17, by the way, demonstrated that AI can achieve diagnostic accuracy comparable or surpassing our pathologists. And they also say, and I have it in orange, guess why I'm having it in orange, that in the United States, over 10 DP systems have been approved, cleared. And the FDA people are sticklers to this terminology. They have been cleared, but we know what they want to say. Basically, digital pathology, they were cleared as a class 2 medical device for primary diagnosis, and that it's happening, right? And U.S. law assigns liability for AI-related misdiagnosis jointly to pathologists and institutions, promoting both accuracy and legal protection for pathologists, which is good. And then in 2019, a working group was established. So this BANF Digital Pathology Working Group. What is BANF? I did find it for you. BANF is, it's like a consortium, or how do I open my, no, I cannot open the comment. Okay, yeah, BANF Foundation for Transplant Pathology. So this is a foundation, and they have this digital pathology working group, and they decided that basically AI can enhance diagnostic objectivity, and then they have these BANF updates. So BANF, they have like a scale or like a grading system of, I don't think I need the headphones, guys. Let me showcase my earrings, of course. BANF has this like a way of evaluating, okay, is the kidney good for transplant or not? And in general, tissue for transplant, but they're focusing on kidney. So they have these BANF updates with AI. Retraining enables continuously updated, globally standardized digital pathology for the transplant pathology. And also, they say something that Andrew in our podcast yesterday said as well, that advanced digital pathology requires close collaboration between transplant pathologists, AI engineers, and cutting-edge GPU resources. And if you want to have it in a regulated environment or as a digital pathology tool, then even more people. It was great what he said yesterday, that so they published this paper about validation of digital pathology tools, and not just AI tools, any digital pathology tool. So he created a tool for H. pylori detection in the Geneva hospital where he works. And he says, making this tool, that would be like 2 or 3 weeks of work, and the validation and implementation and putting this tool in the clinical workflow, that was 3 years of work. So a lot of people were working on it, and I could so relate to it for the validation. Let me take away the store. For the validation we did where I work at Charles River Laboratories, and I am on the verge of submitting the paper also like 2 years later, so I feel a little bit less bad for submitting it since like so much time after we actually validate. So this podcast is going to be dropping within a month. The next paper that I have for you is sorry. Can you do it? Yes. And let me know any comments, any questions, anything that you want to ask, or in the comments, because I see them all. And we're back to our old streaming system. So, and the second one, I only have 3 today. Cytological classification diagnosis for thyroid nodules via multimodal deep learning. Do you guys hear me well? I assume so. If you could confirm, because I didn't put my fluffy microphone from the camera that I have, and I think I'm using this one. Just give me a sound okay in the comments, and I'll know that the sound is okay. So here, personal story about cytology, thyroid. I don't know if you see my scar. I did have a thyroid cancer, and they took, I don't know how many biopsies, at least 3, fine needle aspirates, at least 3, and they were all like non-diagnostic. And I had like a thing size like of an egg. Give me a sound check in the comments, please. That would be fantastic. Anybody who's listening live, you're still there, so I think you hear me, but just to confirm that my microphone is okay. So I had like I don't even know, left side, right side. It was like an egg, and I would go and get these fine needle aspirates taken, and then it would not be diagnostic, right? So let's talk about the situation. And then I was talking to Andrew Bitchkov, who is a thyroid pathologist, and also to Dr. Nikiforov, who is the person who created the World Tumor Registry. And I told them about my tumor. They're like, we don't even really classify it as tumor anymore, but I didn't want to have the egg on my neck. So I wanted to get it out, and it was crossing the capsule already, so then I don't have a thyroid, long story short. But going back to the paper is, okay, and I thank you so much, Richard, for confirming that you can hear me. So the thing is, and this is a publication from China, and the thing here is the rising prevalence of thyroid nodules is straining limited cytopathology resources, right? This is a recurring theme, as basically that there are not enough pathologists and the more specialized you go, the less specialists you have. Resulting in excessive overdiagnosing or overtreatment with significant patient and healthcare consequences. To address this, their AI-TFNA developed, AI thyroid fine needle aspirate. And this was an AI platform leveraging extensive clinical data to enhance diagnostic accuracy and clinical efficiency. And I am always so impressed, like how many samples they get from China. 20,803 thyroid samples were collected from 7 medical centers across different regions in China. And of these, 4,421 thyroid fine needle aspirations from 3 hospitals were used to train this AI, ensuring strong generalizability. And then they validated. What did they do? I should have a comment here. It didn't save. It doesn't matter. But this is so how they scored this cytology. They have the Bethesda scoring system. So they did validation of internal validation. I guess there was an external as well, and it was an exceptional performance. The overall accuracy of TBS1 is 93.27. What is TBS1? Basically non-diagnostic or non-diagnostic or something that is not diagnostic, either like super confusing or non-diagnostic. And the sensitivity of TBS5, so the score goes from 1 to 6. 6 is malignant. This is suspicious of malignancy, and like you go backwards towards non-malignant, but 1 is non-diagnostic. So the TBS5 and 6 reaches 85.37, and we're talking about sensitivity here, and 83.78, while the specificity of TBS2 is 97.13. And let me just check what is TBS2. I think this is like benign. TBS2 thyroid is benign in the Bethesda reporting thyroid system. So this is benign, and the specificity is 97.13. So because this, and I need to tell you something else, because that's not the first time I'm hearing about these massive cytology screening happening in China. They do it for pap smear as well, and they have like AI systems that screen it. So I'm going back. Oh no, I disappeared. They also incorporated BRAF mutation data into this AI, and the development of a multi-model model further improved precision by significantly improving the differentiation between benign and malignant thyroid nodules. And that's what you need to know out of the fine needle aspirates. And they also used a technique called image appearance migration, a technique that substantially improves cross-institutional mother generalizability. So what is this IAM image appearance migration is basically data augmentation and making these images for training, manipulating them in a way so that the model is more generalizable. It includes data augmentation. It also can include the GANs, the generative adversarial networks, and like different AI techniques to make the algorithm more general. We know that these AI algorithms are susceptible to domain shift. And by domain shift, I mean like coming from different scanners, different stainers, different wherever, right? There's a lot of going on in the pre-analytical space. So we try to generalize as best as we can by standardizing pre-analytics, but also implementing some AI to help with that. So okay, so sensitivity was improved by 190 and specificity by 812. And this AI-TFNA offers rapid, reliable decision support, advancing thyroid nodule diagnostics. So another discussion we had with Andrea, and I'm like spilling all the beans before the podcast drops, but I hope that then you want to listen to the full thing. We always have a pretty good flow with Andrea. And let me show you something, because I have a course, it's a free resource that I did with him, and it's in the store. So before we go to our last paper, I'm going to show it to you. Stop sharing and share again. Let me do it. Okay, you should be seeing this. And he is this HistoSuite tools. Let's see if I can show it to you. Yeah, that's him. And he is obviously author of this free tool, and this is a free resource. So if you're interested in how to check your pre-analytics, this is definitely the course or the series. It was a webinar series that we recorded, and now is in a course in the store. So let me give you the QR code to the store now. And let's go back to the papers. But why did I even say that? Because we were talking about, because here this AI helps you like it's a decision support, right? And there's this semi-philosophical, or I would say like not even semi-philosophical, but philosophical discussion. Okay, is it going to make us be stupid? Did I already record that podcast? I might have. There was this paper from Lancet about de-skilling of pathologists. Not pathologists, endoscopists that were doing colonoscopy. AI, they were using AI, and then they took the AI away. They were using it for spotting polyps in colonoscopy. They took it away, and their performance dropped significantly. So obviously this discussion has been going on forever already, that okay, are we going to be like worse as doctors, scientists, or whatever, because we have these tools? And it's an ongoing discussion that I also had with Andrew yesterday, and this paper that we just covered made me think of it. Okay. We have the store. Yeah, so if you want to check the HistoQC, in the left upper corner, there's this QR code to the store. And let's go to our third paper before I give you some more updates. Computational pathology approach, of prognosis and immunotherapy response in pan-gastrointestinal cancer. This is also a group from China. And what did they do here? The background is that current staging method cannot accurately predict survival outcomes and therapeutic benefits in cancer patients. So did implemented so-called digital pathomics. Pathomics is basically like molecular combined with pathology. And You can do it directly from H&E. You can do fluorescence and all different things. But pathomics is basically a combination of pathology and genomics, pathology and proteomics, all the omics with pathology image, right? And this is a rapidly evolving field. And actually, I had a podcast with a person, with Trevor, who has a company called Pathomics. So what did they do here with the methods? There was an international multi-center study that included 2,463 patients with pan-gastrointestinal cancer from 12 cohorts and 7 cancer centers. Again, maybe these were the same cancer centers. The thyroid study, maybe we can check in a second. And then 1,653 patients were diagnosed with gastric cancer. So then they proposed a deep learning pathomics signature, DLPS. Sorry for my handwriting on this tablet. Deep learning pathomics signature, DLPS, by integrating information on 3 scales from the whole slide images of H&E stained tissue, including pathomic features related to the nucleus, microenvironment, single cell spatial distribution. So this is, single cell spatial distribution is going to be probably a lot about the SITC. So if you're there, let me know. The booth was 4:15 with Hamamatsu. So join me if you're there. That would be so cool. And I love that it's so close, this conference. To me, obviously, I can drive there. So, but yeah, we had this single cell spatial distribution, and they assessed the predictive accuracy of the LPS for prognosis, chemotherapy response, and immunotherapy response. And what were their results? They found that the LPS digital, what is this? What did we have? Digital pathomics, deep learning pathomics signature? Yeah, deep learning pathomics signature, deep learning, was significantly associated with overall survival in gastric cancer and pan-gastrointestinal cancers, exhibiting good accuracy, area under the curve values ranging from 0.723 to 0.840. And that indicated the Cox multivariable Cox regression analysis indicated that the LPS was an independent prognostic factor, and nomogram, and I had to check what nomogram is. It's like a diagram, but for more scales than just 2. So diagram would be for 2. And nomogram that integrated the LPS and tumor nodus stage showed improved performance in predicting cancer prognosis compared to that with TNM stage alone. So the gastric cancer patients with low deep learning pathomic score, but not those with high, were exhibit substantial benefits from adjuvant chemotherapy. And then the objective response rate to anti-PD-1 immunotherapy was also significantly higher in low DLPS group compared to, so that was 29.6%, and the high DLPS group was just 8.3. So that's like pretty big difference, I would say, in the immune therapy, immune oncology world. So I was so naive. At the beginning, I thought that these stratification tests will tell you like that those who are not going to respond are not going to respond at all, and those who are going to respond like 100% of them are going to respond. And then when I started learning that, like the differences are like, if you have a 30% difference, you're like golden. I'm like, we're talking about like different scale than I thought. So yeah, now I see like 29.6 versus 0.3, and I'm happy. And before I'm like, what are we talking about? So they concluded that the LPS has the potential to enhance prognosis assessment. And I'm going to comment on has the potential phrase in these papers, and identify patients who are likely to benefit from adjuvant chemotherapy and immunotherapy in pan-intestinal cancers. So has the potential is a common phrase in these in papers, right? Because has the potential, and it goes back to the tool development, digital pathology tool development that I talked about in the podcast with Andrew. And oh my goodness, there's so much more going into developing a tool versus into, and I'm going to put my book here as well. If you don't have the digital pathology one-on-one yet, you can get the free PDF version here through the QR code. But so much more going into a tool than going into a publication, and so much more going into a publication in a peer-reviewed journal than just having a concept and idea. So life is a funnel, like drug development is a funnel, and there are sales funnels. Life is a funnel from idea to product to actually tool. Because Andrew's group developed this tool that they did for H. pylori detection as an LDT lab developed test. And if you want to productize, that's like the next level of complexity, and or like a different pathway that you have to go through. So every time I go to a pathology conference, I'm basically impressed by the number of vendors that are there and those who have clearances from the FDA. It's like such an enormous effort. And I always call the vendors unsung heroes of digital pathology. And I'm always super excited about my sponsors. But what I wanted to tell you is another thing that I'm working on, because obviously ACVP, I'm speaking, right? So again, I need to prepare a presentation. And I'm like, oh my goodness, over and over, I prepare these presentations. And I have I already use AI tools, because without it, I would spend a lot of time on it, and I don't want to spend a lot of time. And I kind of most of the time know what I want to say, what my message is. So let me put this on the side. Can I do it? Yeah. So I'm like, okay, how can I have a process? Is it something I can make into a process? And I did. So I have a process how I do a conference presentation. It's more for like conference concept presentation than a scientific results presentation. So if you are interested in my workflow, my process with like the tools that I'm using, and I'm going to make a separate podcast and probably a video on this, but if you're interested in my process for preparing a conference presentation, leave me a comment. I don't have it like as a QR code yet. I don't have it in a funnel or like in an automated way to share with you, but I can share it with you as a PDF, and then hopefully by the next live stream I will prepare something that I can share as a code. And I'm also thinking of doing a workshop. The workshop is going to be a paid workshop, so when I plan it, I'm going to let you know, but the PDF is going to be free. It's going to be something you can download and basically go and use the tools. I'm going to tell you in a separate podcast how I use the tools, and maybe make a video. If you are listening to this on YouTube, watching it on YouTube, please give me this thumbs up and subscribe button. I'm going to be responding to all your comments. If you have any questions, even when you are listening to the recording, if you're interested in my presentation process, book, courses, you know where to find them. You know where to find me. Never hesitate to reach out. You are important to me, my trailblazers. You don't even know how much you motivate me to do all these things. And the last piece of motivation that I got was from Ingrid from the company Caris. She's going to be a guest on the podcast, and she was like, I listened to you during my lunch, and I want to go with you for a real lunch. And that was so heartwarming. This is always so heartwarming when I hear these things from you. Also, earrings, right? Maybe it's time to buy Christmas presents, and maybe somebody wants these earrings, so you know where to find them in the store as well. And with that, let's put some music on to say goodbye. Thank you so much for joining me.